Hi, this is Dr. Raichel, consultant physician and diabetologist. Today I am going to give a few insights about what is stroke and what are the awareness points we should be knowing. Okay. Stroke is it's also called as paralysis or pakavadam. Okay. In stroke, what happens? There is a reduction in the blood supply to the brain, or there is a bleeding in the brain. How does this happen? It can be due to high blood pressure, or when the blood pressure shoots up, there is a bleeding or rupture of the blood vessel, which leads on to bleeding inside the brain, and this leads on to complications like paralysis of one limb or paralysis of one side of the body, or coma, brain dysfunction leading to coma or even death. What are the risk factors for stroke? Most of the risk factors are the factors like diabetes, hypertension, obesity, cholesterol, increased high cholesterol levels, smoking, alcohol, people who take oral contraceptives, and some people who take illicit drugs like cocaine, morphine, and so on. So, what do we do? What are the symptoms of stroke? Symptoms include, remember the mnemonics: be fast. B is loss of balance. E stands for eye symptoms like blurring of vision or blindness, and F stands for facial weakness. A stands for arm weakness or limb weakness, and S means speech difficulty, and T stands for time to act. And they also sometimes present with confusion, dizziness, loss of vision, blurring of vision, numbness, swaying to one side. Sometimes they may even lying unconscious. So what do you do when you see a patient with stroke? Immediately, it is the time to act, and we have to treat them in the golden period. The golden period is like 3 to 4.5 hours from the initial findings of the stroke. So this is the time to act, and this patient has to be shifted down to the hospital immediately.